Welcome to the 281st episode of the Jami Dulaney Plant Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome, and thanks for listening. I hope you had a wonderful Thanksgiving, and I hope you all are healthy, and you did very well choosing good plant-based, low-sodium, low-oil foods. If didn't go so well, let's get back on the wagon and do better for the upcoming holidays. It's never too late to learn a few new tricks to try to prevent heart disease and reverse heart disease, even though you're going into a bunch of celebrations with the holidays. So I've diverted the last couple of episodes, various things, and I'm going to take a turn back to my roots in cardiology for this episode and talk a little bit about heart failure. It's come up several times. It's something that we see after holidays such as Thanksgiving and Christmas, where people may be getting into more ham and turkey and butter and salt and travel and a variety of things that can exacerbate congestive heart failure. So what is it? In the basic definition of heart failure, it's more of a conglomeration of symptoms than one particular disease. Basically, the heart cannot supply blood and what blood carries, oxygen and nutrients, to the body. And so the body reacts in various ways. And one of the things that happens is because the heart can't pump forward, the fluid in the blood vessels tends to back up, and it backs up into the lungs, causing shortness of breath. It backs up into the abdomen, can cause swelling. It backs up into the organs of the abdomen, liver congestion, and liver failure can occur. It backs up into the legs. So a lot of you may see people with swollen legs. That can be a sign of congestive heart failure. It can be a sign of other things, but that is one of the symptoms. When people have the fluid backing up into their lungs, typically the first thing that happens is they become short of breath when they exert themselves, and then it's worse when they lay down at night. So people will be fine or okay sitting, and when they go to lay down, shortly after getting in bed, they become anxious and short of breath and have to sit up. And it's not subtle. It's not something that rolling over fixes. You have to get up, prop yourself up. And the reason that occurs is that when you lay down, your body starts to resorb all that fluid that's in the periphery. So the fluid that was in the legs starts to be resorbed back into the lymphatics and in the blood system, in the abdomen as well. And all of a sudden, you have that extra volume that your heart has to pump. If it's unable to pump it forward, then typically it goes back into the lungs more, and people become short of breath. The symptoms can build up gradually. So, for instance, holidays, when people just start going out and getting into more salt over time. Sometimes people will even get a nasal congestion or feel like they're stuffy. They have extra fluid in their head. They might get a little raspy cough that they don't notice, that they don't pay much attention to, but they start to have a cough. Or again, the shortness of breath with exertion, and a lot of people aren't doing things, so they don't really realize until they actually have to walk someplace into the grocery store or in from a parking lot that they're short of breath. And then it can occur acutely. It could happen when there's a sudden change in heart function. If the heart rate goes up for some reason, an arrhythmia, and the heart's pumping really fast, the heart can't keep up with supplying blood forward. It backs up, and people get acute shortness of breath. And those people don't have a whole lot of symptoms up until, or they don't have a lot of warning. There may not be swelling in the legs or anything. It may hit them all at once. But the majority of people have some symptoms that are building up, and they may just not notice it or actually ignore it or think that they're chronic, and they put up with it a while until the straw sort of breaks the camel's back and they become more short of breath. Again, if it's fluids building up and then they have a high sodium meal, that can topple them over and cause acute shortness of breath that's much worse. So again, think holidays and think that it's creeping up, and then all of a sudden you have that salty meal or that travel in the airplane where people start to retain some fluids, and boom, they get short of breath. When you get fluid into the lungs and you become short of breath, the first thing that happens is you start to breathe more rapidly. And when you breathe more rapidly, you're having to use more muscles in the chest to breathe quicker and to try to get the lungs to expand against the extra fluid. Think having a sponge in water. So people are working harder to breathe. Typically their heart rate goes up, their blood pressure goes up, and things get worse because more fluid backs up. The other thing that happens is when people start to get tired from the rapid breathing, so the number of respirations per minute starts to go up. They become fatigued, just like if you were running a race, you get short of breath and you're tired of running or tired of breathing fast. Then all of a sudden people can't keep up. And when they can't blow off that carbon dioxide that's starting to accumulate, they become acidotic. And when they become acidotic, the pH drops in the blood, and that also triggers arrhythmias that can make things worse. And typically that results, when you get down that road that far, in an emergency visit, usually by ambulance. Bad things can happen, even sudden death can happen in that setting. So why does it happen in the first place? And again, congestive heart failure is a multitude of symptoms and not necessarily a discrete diagnosis. The most common cause of congestive heart failure is a weakened heart muscle. So the heart muscle itself can't pump the blood forward that it needs to supply the rest of the body with oxygen and nutrients. And a weakened heart muscle most commonly occurs after a heart attack. So if there is a blockage that becomes 100%, or there's chronic low blood flow to an area of the heart, that heart muscle, that particular area stops contracting or severely reduces its contraction. When people get an echocardiogram, an ultrasound to look at their heart function, typically they'll hear a word called ejection fraction, and that's how much blood is beat, how much blood volume comes out with each heartbeat. And the normal ejection fraction is about 55 to 60%. And people can function, mild reduction, 50, 45, without much symptoms in most situations. Even with much lower ejection fractions, people can learn to adjust their volumes and do quite well with ejection fractions that we get down into the severe range of 30 to 35%. They can actually function very well if the rest of the body is fit. But typically this ejection fraction is reduced or when a heart failure occurs in the majority of people. So it can occur because of blockages and, what we call ischemia, or decreased parts of the heart muscle not contracting right, or multiple areas not contracting right. The other thing that can happen is it can be post-viral. With COVID, we always have to bring COVID into every conversation, but because COVID is a virus, there is a viral cardiomyopathy that's associated with many viruses, including the flu, including the common cold, that can leave people with a global decrease in their heart function. And sometimes that comes back, sometimes it stays the same, sometimes it gets worse over time. It's something that we just end up having to follow. Pregnancy can result in heart failure or a dilated cardiomyopathy. Complicated high-risk pregnancies is certainly an increased risk. Sometimes it happens for no apparent reason post-pregnancy. Again, some of those get better, some of them stay the same, some of them actually get worse. And then sometimes we don't know why the heart muscle becomes weakened. We don't have a real good etiology. Probably most of them are viral. You can also have an autoimmune involvement of the heart muscle that causes it to be weak and baggy. And that's another reason. The other way a heart can fail is it becomes too stiff. So if people have long-standing high blood pressure, the heart muscle actually gets very thickened. And over time, that muscle becomes very stiff and non-compliant. So think of it, the heart should be something that expands and contracts. But if the muscle becomes very thick and stiff and somewhat scarred, it's just thick and it doesn't move. So the blood can't actually get in and fill the heart enough for it to expand the heart to get ready for a muscle contraction. So the blood backs up, even though the heart muscle is stiff and it's still contracting, okay, but it just can't relax enough to fill with blood. And we call that diastolic, or an abnormality of filling of the heart, as opposed to the contraction of the heart. And then we can have there can be some hereditary conditions that the heart muscle becomes very thick over time and ultimately fails. And then arrhythmias that cause the heart to beat really fast. The heart can't keep up and blood starts to back up. So those are the majority of reasons for the heart failing to get the blood forward, and more backs up and causes the secondary symptoms of shortness of breath and congestion of the liver. When the liver becomes congested, it may not function appropriately. People may actually become jaundice. They can have abnormalities in their blood counts because of clotting factors. So a whole host of things can happen. You can get abdominal bloating. Sometimes people come in and tell us they just feel that their pants acutely don't fit, or they feel very bloated, and it's because of the fluid in the abdomen. The interesting thing that happens in these people is they also get fluid and bloating of the stomach contents. It's the stomach wall itself, so that people can't actually absorb their medication. So some of the medications we give to get rid of the fluid aren't actually absorbed once things go to that level. And so that's when people require intravenous medications to try to reverse the heart failure and get some of the fluid off. The swelling in the legs, like I said before, can be chronic in some people. It can be a variety of reasons, but it can also lead to ulcers and inflammation in the legs. One of them, people can go along pretty well, and then something happens and they become short of breath. So one of the first things that we do in the field of cardiology is to figure out the why. So is there a primary decrease in the ability of the heart to function and contract, or is it over-contracting, or what we call hypercontractile? So one of the easiest ways to do that is an ultrasound, to look at the heart function. So by doing an ultrasound, we can look at the heart muscle itself. We can look at the valves, because sometimes the heart valves are actually abnormal. They can become narrowed or leak, and that can lead to the heart starting to dilate and not function appropriately. Again, we can see parts of the heart moving and other parts not moving, and that would suggest that there's a blockage in one of the arteries feeding the heart, and so that would lead to more evaluation to see where the problem lies. An electrocardiogram, obviously, or just a physical examination should tell us about valves. It should tell us about heart rate, and then an EKG can tell rhythm, whether there's an abnormal rhythm that's leading to a fast heart rate that's causing the problem. We look at people's blood count to see whether or not they're anemic. If someone is severely anemic, and it can sneak up on people over time, again, the heart's job is to carry oxygen to the tissues, and so hemoglobin, the blood molecule that carries oxygen, if that's low, then the heart has to pump much more. If you think about it as being buckets of water, if you have a big bucket full of water, you don't have to carry as much as if you are carrying Dixie cups to put out a fire. So the heart has to work a lot harder if the blood is low, or the hemoglobin is low, because it can't carry as much oxygen. So it pumps faster to circulate what blood volume it has around. So we look at the hemoglobin to see if that's contributing. Thyroid can also affect the heart function. If the thyroid function is low, that also affects the heart's ability to contract. And so some of those are easy fixes. By improving the hemoglobin or improving thyroid function, then the heart muscle starts to regain its normal contractility. But getting the heart rate to slow down or get back into a regular rhythm improves things rather quickly. And then, the other thing that we're left with, if there's been damage and permanent scarring, then we might be left with a heart muscle that doesn't get better, or it stays at that lower ejection fraction. Sometimes improving the blood flow to the heart it can fix that. And typically in the past, when people have heart failure, get a heart catheterization. If there's blockage, people get a bypass. And if that muscle's still viable, then the blood flow to the heart is improved and that contractility increases. The other way you can do it is to eat a plant-based diet, get those 6 cups of greens in a day. That opens up those tiny collateral blood vessels to the heart, which again improves blood flow a different way, and the heart function can come back. So there are a couple different ways to make things better, and obviously nutrition is paramount when it comes to heart failure and fixing it. But again, if the heart muscle's stiff, typically that may have to do with some small blood vessel flow. It may have to do with chronic high blood pressure. So getting the blood pressure down is going to be the way we go about that as well. What people don't realize that for an episode of congestive heart failure, people's mortality is actually shortened, especially if the cause is not a reversible condition. So a damaged heart muscle, weakened heart muscle, the mortality can approach 50% over the next 5 years. And that's all comers. Fortunately, there's a lot we can do to change those odds, but it requires a lot of audience participation. The first thing that's done in most settings after a diagnosis is made and the why is people are put on multiple medications. So they're put on a medication to slow the heart rate down. They're put on a medication to decrease the heart's response to adrenaline. They're put on medications to decrease the blood volume, water pills, so to speak. And they're put on medication that affects the blood flow of the kidneys to decrease the kidneys' salt and water resorption. One of the things that happens with people in heart failure is that their kidneys aren't being perfused with blood, so the kidney sees it as it's not getting enough blood flow, so it releases hormones that cause salt retention and water retention. So people that have abnormal heart functions typically are very, very salt sensitive. So just a little bit of extra salt can result in a lot of water retention. And then if you add pre-existing kidney disease onto that, the kidneys are already resorbing more salt and water than they should, and it can make matters worse. So the more organs that you have a problem with, the less room you have for error. Hypertension is the leading cause of congestive heart failure. Again, over time, it can cause a weakened heart muscle or a stiff heart muscle or a stiff and weakened heart muscle. So preventing long-standing hypertension or the effects of hypertension is paramount. That's why, it's one of the reasons why hypertension is the silent killer. By the time things have progressed to the point that the heart starts to fail, the ability to reverse things is decreased. Not always, but it can be decreased. So that's one of the first things we want to address. Just giving people blood pressure medications doesn't reverse the cause of hypertension. It lowers the blood pressure, so it's going to decrease the secondary effects of hypertension. So by controlling blood pressure with medications, we are decreasing the risk of congestive heart failure. So that's important. But do you have to take medications? Can you get off of medications? Well, you can, but again, it's not, I just don't want to take medications. They make me feel bad, so I'm not. It is, what can you do to improve your blood vascular system and your heart function so that you don't need blood pressure medications? And again, we'll come back to what you eat is going to be very important, and how you breathe is going to be very important. And your overall stress and reaction to stress is going to be very important. The same way with blood flow, if the heart muscle's not getting enough blood flow to it, coronary artery disease or blockages, by the way, changing the way you eat, obviously will improve the blood flow to the heart and may improve the overall heart function. If the heart is not functioning because it's going too fast or there's arrhythmias, then most of the time there's been some chronic stretch of the heart that's led to arrhythmias. There may be calcification of the heart that's led to electrical problems. Some of these can be fixed with ablation, some of them can't. Sometimes improving the blood flow to the heart fixes these arrhythmias. Sometimes decreasing the stretch on the heart. So it comes back to high blood pressure. High blood pressure is one of the leading causes of the most common arrhythmia that we have is atrial fibrillation. So atrial fibrillation, the heart tends to go fast, and the heart can't keep up with the blood flow that's coming in, and blood flow goes back into the lungs, and you get congestive heart failure. So by decreasing the blood pressure, decreasing the stretch on the heart, you can decrease the episodes of atrial fibrillation. Again, diet is paramount in trying to get these things under control. That will limit the amount of medications people need and improve their overall longevity and well-being. So once a person has got to the point where they have episodes of congestive heart failure, now we're at a point in someone's life that little changes aren't going to significantly I guess there's not going to be a great benefit from small change. It becomes that we have to be very locked into making the body function as good as it possibly can. For an example, if somebody has a very weakened heart muscle, and they're terribly overweight, and they're terribly out of shape, then their heart has to pump more to move that body. If you're overweight, fat has a tremendous amount of capillaries and blood flow to fatty tissue. So your heart has to pump to all those areas. So the bigger you are, the further that your heart muscle has to pump into this arterial system. So being overweight severely stresses the heart muscle. I like to think of it, if you have a smart car engine and you try to put that in a Cadillac, it's not going to move very fast. Old Cadillac is big and bulky, and it needs a giant engine to move it. On the other hand, if you have a very light smart car, but you have a great engine, obviously the car would go very fast. So people that have a bad engine, a bad heart, need to have a body that's easy to move. So the lower the weight, the better. The other thing is, the better that your muscles work, the better. So if people are in shape, they've walked, and they've developed, good blood flow, their blood vessels are good. They have a lot of blood vessels distally. They have a lot of muscle that contains mitochondria. They can process oxygen better. They do much better than if their body's weakened, and again, they're just pumping blood to very weakened tissues. So that makes a big difference, and that's where cardiac rehab comes into play. When we make somebody's muscles better, their peripheral, they're able to walk better, they don't need quite the cardiac function that somebody that's much weaker needs. A good example with this is, if you've been in bed, you've had the flu, and you get up, you're somewhat, you might be short of breath exerting yourself because it's harder to move those muscles. It requires a higher heart rate to actually get blood flow to these muscles that aren't contracting as appropriate as they should have been, or as they would before you got sick. Again, if you want to link it to COVID or influenza, this is when older people get into trouble at this time of year. They get an infection, their heart rate goes up, their temperature goes up, the weakened heart muscle has to pump more blood because the heart rate's higher, the temperature's higher. They get in bed, their muscle mass starts to decrease, so it becomes harder to move. When they try to get up, it takes more exertion, their heart rate goes up again, their blood pressure may go up, and it really is a stress on the heart. So when we say post-viral cardiomyopathies, it can be because the heart muscle is affected directly, or it can be that the heart has to work a lot harder because the body's weakened. So if somebody has a weakened body going into an infection and then they're laid up, obviously the risk is much higher for them to have cardiac problems just because their heart's having to work so much harder after an infection. Same thing can happen after a broken leg. Again, somebody breaks their leg, they're in the hospital, they're laid up. um, their heart has to work much harder to get them up, moving around. So again, a body that's kept moving, people that, that's why it's important to walk, to keep your muscles up, to be able to get off the floor, so that if something happens, it's not such a strain and stress on your heart. The big one, salt, and that's where it's everywhere. People say, well, I don't use a salt shaker. The majority of people that we see that go into congestive heart failure because of too much volume, because they've eaten too much sodium, is not because of what they used with the salt shaker. Even though a teaspoon of salt is more than you need for the entire couple of days. You can get up to 2 grams of salt with a teaspoon of salt. So you can overdo with a salt shaker, that's for sure, but the majority of people get the excess of sodium from the food that they eat that's already in there. So think packaged food, Healthy Choice, Marie Callender's, any kind of Amy's, people say Amy's vegan food, or any of these, takeout box, frozen entrees, frozen vegetables that have sauces on them, packets of seasoning, packets of anything in a box, because salt is a preservative, so it tends to have a lot of sodium, and it's when you look at the sodium on a package, it's salt per serving size. So a can of beans may have 3.5 servings at 450 to 650 milligrams of salt. So you have to look. So it's very important to look at the sodium size. If you look at pasta sauce, typically the serving size is 1/4 cup, so it may have 3 or 4 600 milligrams of sodium. You have to look. Canned soups, box soups, a tremendous amount of sodium. If you go out to dinner and you have soup, you can rest assured that there wasn't low sodium broth or low sodium beans or low sodium vegetables added to that soup. It's going to be full salt, and there was probably salt added to it on top. So soup is one of the worst things that people can eat out if they have a history of congestive heart failure or weakened heart muscle. And of course, it's typically what people go to pick because it's easy to eat, and it's soup. People like soup, or they get an appetizer soup. So a cup of soup can throw a person into congestive heart failure in the right setup. A piece of pizza can throw a person into heart failure in the right setup. Think pizza, think cheese. People think that feta cheese is one of the more healthy cheese, Greek feta cheese, but it's also one of the highest sodium-containing cheeses. But pizza cheeses or any kind of cheese are very high in sodium typically. So it's a salt load on top of everything else that, again, is added to a pizza. If you think any kind of processed meat, it's going to be very high in sodium. So pepperoni, sausage, fake meats, faux meats, very high in sodium. It all adds up. Even condiments, mustard, contain anywhere from 55 to 110 milligrams of salt. Ketchup can contain significant amounts of sodium. Milk products contain extra, amounts of salt. It all adds up, and the recommended dosage of her maximum RDA for sodium is 1,500 milligrams a day. If you just ate fruits and vegetables, you get 700 to 800 milligrams. So that means you only have 700 to 800 milligrams more to play with. So again, if there's 400 milligrams in a servings of beans and you have 3 servings, you've already gone over your sodium requirement. Again, it adds up through the day. So if somebody has bean soup for lunch and then pizza for dinner, you can see that people can get 5, 6, 7, even 10 grams of salt if they eat out a day. And that's enough to put, and it may only take 2 grams or 3 grams of salt to put somebody in heart failure. So it doesn't take much to get to the tipping point where people are in trouble. Sometimes it occurs chronically. So people are getting, say, 2,500 milligrams of sodium a day extra, maybe just 2,000 milligrams. So day in and day out, they're just having a little bit extra accumulation of salt, a little extra accumulation of fluid into their system. And then the next thing you know, they're in heart failure. So the easiest thing we have people do is weigh themselves daily. Doesn't matter what the number is, it's the change in number. So if you get on the scale in the morning and the next morning your weight is up 3 pounds, that means that's all fluid for the most part. So that's all water and salt retention. Nobody can really eat. Most people can't eat that much food in a day, so that excess weight is water. If people retain enough water that their weight goes up that much, they start getting a bloating or a thickening of the stomach wall itself, and they might not be able to absorb their medications enough to help them. So then they really get behind the eight ball. Their heart rate may go up, their ability to get the fluid off may be more difficult, and things start to compound. And next thing you know, people are up 8, 10, 15, 20 pounds of water. That ultimately requires hospitalization with intravenous medications to get the fluid off. You don't want to get there. And if you really manage your diet well, you can really get rid of a lot of medications, especially the water pills. And most older people don't like to take water pills because it causes them to have to use the bathroom all night long. It causes urgency. It may cause incontinence. And then people don't take their medicine, and it becomes a real issue. So watching what you eat is imperative to being able to decrease the dosage of these diuretics or water pills or get off of them completely. And we have a lot of patients that we educate to the point where they can take the water pills only intermittently if their weight goes up, if they go out, if they had, something happens unforeseen that all of a sudden their weight goes up. But the most important thing that you can do is to weigh daily to track whether or not your weight is going up, because that's the best sign of fluid retention. There are people I've had over the years that can look at their skin turgor, so you can pull the skin up on your arm and you can tell whether it's more taut, or people feel like their pants are too tight. That's a sign of fluid retention. Sometimes people get swelling of their legs very quickly, and that's certainly an easy sign if you get swelling of your legs all of a sudden to know that you've got extra fluid on board. But by the time you get your legs are swollen, now you're probably talking 5-8 pounds of extra water. If your belly's swollen, it's at least that much extra water. So when we look at swelling of the ankles, sometimes people wear socks and they'll say, well, they've got swelling in my ankles because the elastic on my sock is leaving an imprint. And that may not be such a reliable sign. Either your socks don't have that, or you have some kind of mark left just because of the way the sock rubs. The best thing to do is to take your first 3 fingers and put it at the top of your foot, by the bone in the middle of your medium malleolus or the ankle bone. Just put those 3 fingers above your ankle bone, just in front a little bit, and just gently hold pressure there for 15 or 20 seconds. And when you take your fingers up, if there is indentation, then that is swelling in your ankles. Once you've kind of looked at your legs and your ankles, you can tell whether you can see the veins in your feet. Most people, you should be able to see the veins sticking up in your feet quite easily, especially in your ankle bones. And if you can see that on a chronic basis and then all of a sudden you can't, then that's another indication that your legs are swollen. Congestive heart failure is something to be taken very, very serious. Again, there can be up to a 50% mortality in the next 5 years if it's not taken serious. And it's not something to address intermittently or ignore intermittently. It's something that needs to be watched on a daily basis. And even if you so-called fix the problem, get the blood pressure under control, change your diet, it's always in the background. You have to always be diligent. It never goes back to, when you were 16 again. You always have to be very diligent about watching the salt intake. Again, especially as people get older, the kidneys don't work as well as they did when you were a child. So salt and water retention by the kidneys is in just about everybody as they get older, approach the 50s. So you have to be very diligent about watching the sodium in the food. And again, the best way to get things under control is to get the body mass index under control. So that is congestive heart failure 101 in a pretty quick nutshell. And like I said, it is very important to take it serious. It can be managed very well, but it has to be something that you think about every day. And you think about it every meal, and you make your body the best that you can. So if you make the rest of your body in good shape through exercise and cardiac rehab, and you eat correctly, you can do very well with a decrease in heart function after a heart attack. But it's not something that you can ignore and look after intermittently. You can get off a lot of your medications if you're diligent about your nutrition and your exercise. You cannot, and I will say again, please do not stop your medications without the advice of a physician. We work with people very closely in my office to get them off of medications. We follow up with our heart failure patients on a weekly basis. A lot of the time, especially my older folks, a week basis, every 2 weeks, we check in with them and are in very close contact with them and watch and educate them on what they eat and what triggers a problem. And by working very closely with people, we can keep them out of the hospital. And that's really important now, as it is, with everything that's going on. But it's really important for quality of life to be able to say you can have a good quality of life if you've had congestive heart failure, but you have to be diligent and you have to work at it and work closely with your physician to pay attention to things. And so we aim to get people off as many medications, and especially the water pills, because they're really nasty as far as lifestyle. So if we can get people off of them, and the majority of people we actually can, so it works out good. So that's about it for today. If you have any questions, you can email me at jami@drdulaney.com, jami@drdulaney.com. For this holiday season, Addie and I are offering gift certificates for a conference that's going to be held in January. It's going to be a Zoom conference where we make 6 entrees that are traditional standard American food, entrees into plant-based, whole foods, sugar, oil, and salt-free. So, 2 lunch, 2 dinners, to try to get people that might be thinking about going plant-based or might want to get healthier, but they're just not sure about how to pull it off or don't want to give up their regular food for the most part. So we're going to give a demonstration on how you can take food that you have eaten all your life and make that healthy and plant-based. So those are available through drdulaney.com, DOCTORDULANEY.com. We're going to have the live Zoom conference for those people with the gift certificates. Then there'll be a question and answer session. That Zoom video, there'll be a link to watch that then over the next week and send in questions as well. So going over and look into getting somebody that you might want to get more people on your team in the first of the year, or give somebody the gift of health so that they can get better. If you're interested in working with us to improve your health, if you've had congestive heart failure or know someone that has congestive heart failure that can't get things under control, please look into our practice. We work with people all over the country to help them optimize their health. Congestive heart failure success is about working closely with a physician. To get off medications, you have to be plant-based as far as I'm concerned, and work diligently with a physician that can get your sodium under control and your nutrients under control and get the blood flow to the rest of your body as good as it possibly can. So we'd love to work with you. It's one of my favorite things to do, is to keep people out of the hospital that have weakened heart muscles. I trained at the University of Pittsburgh, which was a heart transplant center. And what I did learn from being there was the original equipment by far is the best equipment. The gift of a heart is like no other. Someone has to die in order for someone to get a heart transplant, and that is a wonderful gift that someone can give in their passing. However, the heart recipient and the rejection issues that can happen and the follow-up that's needed, it is by far not a walk in the park. So the original equipment is the best equipment that you came with. So even if your heart is not in the shape it was when you were 16, keeping the heart that you have working in order is much better than the alternative. So if you have any questions, I'd love to help or answer them. And move your body, eat plant-based, get some sun, be kind to others, and I'll talk to you next week.